Добрый день. Меня зовут Сергей Пономарев.
Hello, my name is Sergei Ponomarev and I'm a journalist. The world is on the eve of the second wave of COVID. We have become more cautious. We take this matter seriously. We wear masks. I only took it off while we are recording. Today we'll talk about whether the mental health of Kazakhstanis is ready for the second wave. Our guest is Sapar Rakhmensheev, medical director of the Mental Health Center. Hello. Hello. Are Kazakhstanis mentally prepared for the fact that things might change to the worse for the second wave of COVID?
Конечно, мы готовы. То есть наше население готово. Почему? Потому что
Of course, our population is ready. We have already gone through it this summer. Our people contracted this viral infection. We are mentally prepared, but still fail to comply with all requirements. There are people who book restaurants, organize big celebrations. Every time I see this, it makes me shiver, because they don't realize that it is about people's lives.
плохо. Почему? Потому что
Recently, I saw on TV that about 200 people were celebrating something at the restaurant.
вот недавно показывали по телевизору, что
Imagine if one of them is infected. 199 people are at risk of being infected. You remember people didn't believe in this infection and wrote in social media, "This is a lie, don't believe this."
Вы же помните, как наш народ не верил в эту инфекцию.
And when their relatives, friends, acquaintances began to get sick and some of them died,
Это ложь, это вранье.
then our population began to react and really understand how serious things were.
Тогда наше население начало реагировать и начали понимать, и начали воспринимать это очень серьезно.
All Kazakhstanis know someone who has been ill within their family, relatives, friends, classmates. Some may even have passed away, and nevertheless, we forget it very quickly. Why? Is this how the human psyche works?
Понимаете, это можно забыть.
Yes, you might forget something if it has passed, but pandemic is ongoing, it never stopped. And we must learn to live with this virus, it is nearby.
Вместе с этим вирусом. То есть вирус, он находится рядом.
We must learn to defend ourselves, keep social distancing, wear masks and wash hands, and not to go to the crowded areas, that's it.
Чистые руки. И не ходить туда, где очень много людей.
I know some people whom you consulted. They had a fear of COVID, even while in isolation. I know you helped them. Is there such a diagnosis, covidophobia? What do you recommend to people?
Людям помогали, выводили из ужасного стресса.
Да, на самом деле сейчас квалификация международного такого диагноза.
There is no such diagnosis in the international classification, but we have such concept.
Когда все было закрыто,
During the lockdown, when everything was closed and everyone was sitting at home, people developed fear of infection. They began to panic.
были такие пациенты, когда им говорили, что у вас ПЦР положительный. Вот я лично сам видел таких людей.
Some patients, when they were told that their PCR test was positive for COVID, they got hysterical, crying, "You are wrong, it cannot be, I didn't leave the house. I only went to the store and that's it, you are wrong."
Дело и все. То есть вы ошибаетесь. Вот тогда мы уже начинаем...
That is when we step in, we try to calm them down, explain, and after 15-20 minutes they would come down and say, "Will I recover?"
Смотрите и говорит,
I'd say, "Of course, but we need to begin treatment, and after that you will be fine.
мы должны начать лечение.
Of course, you will return to your family, you will return home, go back to work."
Вы вернетесь в свою среду и дальше будете работать.
And after that, the patient began to recover, and rather quickly her spirit improved. It turned out to be curable. I say, the most important thing is not to panic. If a person doesn't believe and resists the treatment, there is a 50% chance that the treatment will not help.
Человек успокаивается и дает себе
And when a patient is calm and gives himself an instruction to be treated, he begins to fight this infection. There were patients who were in intensive care. They refused to eat, to take medications. I know such patients. Our specialists talked to them and explained the cause of treatment. I can understand these people. They are in intensive care in a serious condition and say, I don't want to live. Why do you treat me? I remember one day an 87-year-old woman was brought to our provisional center along with a man born in 1981, right after her. 40-year-old man? Yes. What happened next? Imagine, this elderly woman fought. She said that everything would be fine. She took medications and in 5 days she was moved to the general department. She underwent a course of treatment for 18 days. Then we discharged her and she went home. She was so happy and kept saying, I'm going home. She survived. And what about that young man? We transferred him to another hospital, to the intensive care unit, where he received his treatment. We should explain to the audience that an emergency provisional center was arranged in the mental health center to accommodate people with COVID. And you, a psychiatrist, also became an infection disease doctor, providing both treatment and mental support.
Мы развернули на 350 коек провизорный центр, и ковидных больных начали привозить.
We opened a provisional center for 350 beds and began receiving COVID patients.
Были тяжелые, крайне тяжелые.
We treated them ourselves. Yes, there were difficult patients who were really determined to refuse treatment. Then we started proving that the temperature is high, that they have a cough, showed them their X-rays explaining that they need treatment. And they were like, no, I'm healthy, I need to live.
Я должна уйти. Были такие пациенты. Но мы старались им оказывать психологическую помощь и медикаментозную.
There were such patients, but we gave them psychological assistance and medication.
Начинаешь им объяснять и разъяснять.
When you begin to explain to them, especially those in the intensive care unit, they start fighting this infection, and we are there for them.
Помогаем, то есть мы для них.
We give medicines to relieve fever and shortness of breath. And when patients start taking the drugs, they see the effect, and the next day we would see that the desire to live returned.
Понимаете, и пациент видит, и на следующий день, когда приходит,
They are in better spirits. They start joking with employees, nurses, saying, yesterday I was fussy, I was wrong. They apologize. Forgive me, I was too aggressive. I'm sorry about that.
наоборот, просит извинения. Простите, я вчера был, оказывается, агрессивный, я прошу прощения. То есть они начинают осознавать.
Are there any generally accepted recommendations for people who are locked in their homes?
Какое-то время не могут выйти оттуда.
Во-первых, я советую как специалист, не надо зацикливаться на этом.
Firstly, I advise as a specialist not to get hung up on this. We must constantly be distracted. Each person has a supply of positive emotions. What is it? We had a lot of fun days in childhood. We spent them with our parents. We were happy. And this is what we call positive emotions. We need to use these emotions. Our happy memories. Yes, positive. School time, student life, weddings, vacations, whatever you want.
Должны уже оттуда вытаскивать.
Yes, and we need to drag these memories from deep within. Think about those moments. We must stay distracted, read good books, watch comedy films, and think positively. This will always help us win.
Будем постоянно выходить победителем.
Вот за этот год
This year, the whole world and Kazakhstan have gone through a lot.
вот скажите, пожалуйста,
Taking into account what had happened, what you observed, the pandemic, the provisional center, considering all listed, how are you doing? Do you have enough specialists, enough medications? Are you ready for the worst scenario?
к тому, что сценарий будет развиваться по-плохому, события будут развиваться гораздо хуже, чем мы можем предположить.
Мы готовы. То есть, во-первых, запас медикаментов.
Yes, we are ready. First of all, we have already acquired a supply of medicines. We have purchased all the necessary drugs in the summer and in September.
Приобрели оборудование, которое нам нужно.
We keep everything in stock. We have acquired the equipment that we need. 2 mobile X-ray machines, 8 ventilators. We are 100% ready.
Строятся модульные.
You know that modular infectious disease hospitals are being built almost in every region of the country. What does it mean? It means that we are already prepared for the second wave.
Мы уже
As far as our center is concerned, we have been hiring young specialists for 3rd year in a row.
в этом году мы приняли 6 наших молодых специалистов.
In 2019, we hired 8 young doctors. This year, we hired 6. Our team is growing. We'll fight this infection, but we lack clinical psychologists.
То, что хватает ли психологов, на самом деле есть понятие клинический психолог. Вот клинических психологов у нас на самом деле...
So you are saying that the psychologist can go to the intensive care unit and calm down a person who is tired and has no positive emotions left. The patient doesn't want to fight, and the psychologist can provide help. Is this what you are referring to? There are psychologists and there are clinical psychologists. Clinical psychologists graduate from medical university and further develop by getting additional trainings in psychology. In our center, there is a clinical psychologist who really helps people, who conducts psychotherapy individually and in groups.
Есть, да, и мы планируем обучать.
We plan to train our psychologists in clinical psychology. We have enough social educational psychologists who are on the helpline answering phone calls.
Телефон доверия, который отвечает на телефон.
We have enough of these specialists. We gradually solve this problem of lack of specialists, hiring young doctors every year. In 2 or 3 years, we'll fill all vacancies of psychiatrists.
В течение 2-3 лет мы полностью закроем нашу нехватку, вакансию психиатров.
Я знаю, что вы...
I know that you have been infected with COVID yourself. Could you tell me, how does COVID affect mental health, memory?
Нет, конечно.
Of course, at first, when I was told that my PCR test was positive for COVID, I got really scared. Not concerned, but actually scared.
Внутри страх. Неужели ты я? Неужели ты
Yes, I had this fear inside me. Is it really happening to me?
в больницу? На самом деле никак.
When I was told that I need to be hospitalized in an infection diseases hospital, I put myself together. I still remember this feeling. I said, let's go and be treated.
Слава Богу, у меня хронических заболеваний нет, того нет, этого нет. Но мы будем бороться.
Thank God I have no chronic illnesses. This coming down, as I said before, is 50% of treatment.
И все, и у меня такой сильной температуры нет.
I didn't have very high fever. I just had a sore throat, a cough, and when an X-ray was taken, I was diagnosed with pneumonia. The treatment began. After it, I took another X-ray, 2 PCR tests. Everything turned out fine.
Сдавали, да, и все нормально вышло. То есть, о чем я хочу сказать, о том, что
People are not only scared of COVID. Any other disease raises this feeling in any person. We need fear because it is a part of our instinct of self-preservation.
человек должен быть победителем. Инфекция, она будет ходить. Но от этой
People must win. The infection will continue spreading, but we must be able to defend ourselves from this coronavirus. I want to say that we are talking about people's lives. Why quarantine? Why announce lockdowns? Why? So that this infection doesn't spread further. But it depends on people, not only on the state. It depends on the people themselves. People must be able to protect themselves. People must endure. I hope that this will not be with us permanently, that it will pass. We must spend this time together, and we must be the winners. The infection shouldn't take people away from us, not our relatives, not our friends. We must fight, and therefore I once again ask our population, our people, to comply with all recommendations.
Мы должны уметь бороться. И поэтому я еще раз прошу наше население, да, наш народ, чтобы они соблюдали это все.
Could COVID be an impetus for the development of schizophrenia?
Вот недавно я читал статью, что бразильские ученые, то есть написали статью.
Just recently, I was reading an article by Brazilian scientists who wrote that COVID can cause mental disorders.
Сейчас в данный момент вот каждый раз, когда человек начинает думать о ковиде, то есть
This should be studied. Now, when a person thinks about COVID, the first thing he feels is fear. Why? Because it's everywhere, on the TV, on the internet. People receive information that COVID can cause a mental deviation.
может вызвать у человека психическое отклонение.
I don't think that there will be strong deviations. If the person wasn't predisposed, if there was nothing like this in his family, there should not be such a strong deviation, in my opinion.
У этих людей сильно такого отклонения не должно быть. Я так думаю.
Вопрос не связанный с ковидом. Вы знаете,
Why our people have this mentality that one should not go to a psychologist or a psychiatrist? What is your take on that?
должно быть по-вашему.
Вы помните, в советских фильмах везде показывают, что если человек не понравился, то человека начинают...
In Soviet films, there was a common plot that whenever someone didn't like a person, that person was sent to the psychiatric clinic and get treatment. I think this stayed in people's memories, resulting in the way of thinking that if you go to a psychiatrist, firstly, they will turn you into a fool, secondly, they will give you drugs that will really make you insane. In other countries, there is the opposite attitude. It is prestigious to have your own psychologist or psychiatrist. We don't have that. We must come to this. Of course, I myself, our employees and colleagues talk about it every time. For example, we never register patients without their consent. We can consult anonymously, without asking the name or occupation. If there is a pathology, we'll say to the patient, "You have a pathology, you need to be treated, or at least receive free medicines, and it's better to be registered with the dispensary and get medicines for free." And people say, "No, we don't want to get registered," and then they buy their own medicine and begin to receive treatment themselves. Such people usually get treatment in private clinics. How do you see the future of psychiatry in Kazakhstan?
Во-первых, что население начнет доверять нам, психиатрам. Одно слово, вот этот психолог у нашего населения...
I see more trust from the population toward psychiatrists. At the moment, the notion of psychologist is associated with fear. People think, "I'm not a fool. Why should I need a psychologist?"
Наше население, наш народ.
So, in the future, I hope people will trust psychiatric service, because now they think that those who work with psychologists are mentally ill. This is not true. Every person needs a psychologist who will provide help in certain situations, give guidance.
И поэтому я в будущем виду...
I also envision our mental health services being more available. Our people will trust our psychologists, psychotherapists, and will continue developing.
Ну что ж, спасибо. Спасибо за такие
Thank you for comprehensive answers to my
Мои
questions.
вопросы. Мы говорили
Today we talked about COVID and the psychiatrical medicine in Kazakhstan with the head of the Almaty Mental Health Center, Sapar Rakhmensheev. Goodbye.